The module that I was asked to manage is related to the identification and evaluation of dental literature, specifically research literature. I spent 25 years as an educator in prosthodontics, running the graduate program at the Mayo Clinic. And since that time, since I retired hypothetically 3 years ago, I've been in an implant-only practice. I also edit the International Journal of Oral and Maxillofacial Implants, which is the largest circulation implant journal in the world. So my life is spent not only doing implant dentistry, but also evaluating research articles for the journal, evaluating and selecting articles that will see publication. The reason that this topic is so important to an implant dentistry curriculum is that individuals have to understand where the science is so that they know where the science needs to advance. Certainly, if folks are not able to evaluate where we are at the current position, our ability to design research or even to design clinical practices is severely compromised. So knowing how to find literature, how to evaluate literature, what levels of literature are meaningful and which ones we might base a change in our style of practice upon becomes critical to us in terms of our long-term management of patients. The topics that this module addresses are primarily the identification of what is and what is not scientific literature, looking at what is identified as scientific literature, and then considering how that literature falls into a hierarchy relative to truth. And then once we determine that hierarchy, how do we identify scientific literature out of the mass of literature that is available for us to evaluate? And finally, there's the question of how we can transform that stack of literature into something that we as practitioners can utilize as a personal literature database, and then how we might search that literature database to either confirm that what we're doing is appropriate, or perhaps include some of this information in scientific papers that we write and submit to journals. After completion of this module, I would expect that the learner would be able to very easily identify which sort of information is qualified as scientific information. And then I'd expect them to be able to easily go onto the internet, perform a scientific literature search, and then evaluate the information that came from that search to determine which is the most likely information to be telling the truth, which generally transforms into which is the least biased information that's available in the scientific literature.